World Health Organization Patient Safety Checklist. The Patient Safety Checklist is a series of systematic checks that are performed as part of the perioperative process. This is in compliance with the WHO standards as well as to ensure the safety of both the patients and the surgical team. Once the patient arrives at the operating room lobby, the operating room nurse receives the endorsement from the ward nurse. After receiving the patient, the OR nurse uses the preoperative checklist as a guide to ensure that the patient is fully prepared for operation. Once the preoperative checklist has been completed, the sign-in phase is conducted before the induction of anesthesia.
Hello po. Good morning, Manny. So ako po si Mrs. Basilio, no po. Ako po yung head na dito. So, si Dr. Taylor po, anesthesiologist. Tapos po, si Dr. Manalastas po, siya yung mag-opera, no po. So, hindi po ako mag-a-assist sa inyo, yung isang staff ko. So, yung talaga po nagulama is Adelina Guzman. Middle to Arcilia. Si Miss. Para si So, alam ko kung allergy kayo panalo. Hindi po, natangin naman akong panulo. Tabletas. O kay po, kaya mamakan. Alam ko po. Alam ko yung oras ng panulo.
Pero nung kami to 10 ka, dapat nabi ko, ano po, 9:30.
So, ikaw po yung kaya makita mo?
Palwapit ako pagdating ng pagbabago na yung hindi ako makakaya.
Yan po may consent. So, i-explain na kung okay kayo yung nagawa ng anesthesia niya po. So, balo yung naman pupunta niya. So, nakikinig ako kay nervous. Yan, relax. Yan.
Kaya po nga anesthesia, sinabi na lang po kay guardia kayo, maglagyan kami panulo, patutulan na kayo, maglagyan kami yung pakapatan. Pag gayon na po balo, maglagyan kami temporary tubo. Na po balo pa. After na po yung operasyon, tapos temporary tubo, dala ko tayo. Pagala namang komplikasyon, ang gayon ng mga isnawa, or alagay ng mga makakalagay na po. Pero ating pong instances na delay tayo ng pamag-extubig. Ang pamilya ko tubo. Kalo pa rin pagkalitira na, pag yung mga snawer, marakaglayan. In the time na ating makanta, kaya po ibutan yung tubo, agising, kaya po kiketan. Kaya ka rin po po mga snawer. Eventually, pag gagawin ng mga snawer, loko po niya po ito. Okay?
Ready na kayo po. Okay. Aray ko meron. Okay. Sige.
May
Palagdan na kayo po kanya, tapos mag-start na lang po kanya. Okay? Sige mama. Okay.
During this phase, the patient's identity is confirmed verbally with the patient or with his or her significant other. The patient's identity is also confirmed in comparison with the patient's records and wristband. Checking for the completeness of the consent form and confirmation of the operative site with a mark made by the surgeon is done. Confirmation of removal of dentures, jewelries and nail polish is also done. The receiving OR nurse will also ask regarding the patient's last meal as well as allergies to food or medication. The anesthesiologist and surgeon will also reinforce the technique and procedure to the patient. After performing these checks, the patient is then moved into the operating room. The next phase of the patient safety checklist is the timeout. This phase takes place before the start of the operation. In our setting, it is conducted by the circulating nurse. The surgical team reconfirms the patient's identity, procedure to be done, and the availability of the consent.
Good morning, all team members. Please introduce yourselves by name and functions.
Dr. Michael David, surgeon. Dr. Arcilia, Mrs. Smith, crowd nurse.
Ano kaya na circulating nurse?
Okay, our patient is Rachel Raimundo Alcantara. Side abdomen. Doc, what's the procedure?
For emergency PCS1 plus PPL.
Are there any critical events, Doc, regarding the surgery?
We are expecting reduced bleeding in this case. So the total surgery time will be 1 hour.
What
The
about
total blood
the-
loss of 400 or 500.
What about the anesthesiologist? Are there any special question regarding the procedure, sir?
Same bleeding and possible.
Are the antibiotic prophylaxis given within the last 60 minutes?
Capacity grams IV given at 11:30 a.m.
The anticipated blood loss is also confirmed, as well as the availability of the correct imaging displayed if necessary. Any specific concerns of any member of the surgical team is also specified in this phase. During this phase, the sterility of the instruments are also confirmed by the scrub nurse. Once these checks have been completed, the procedure can be started. The third and final check is the sign-out phase. The scrub nurse announces the completeness of count of the instruments, sharps and sponges, as well as equipment used in the procedure. The person in charge of the specimen will confirm that they are labeled and logged accordingly. Any concerns, issues and problems regarding the equipment used are raised.
10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Doctors, I'd like to inform you that all shards, instruments, sponges are not listed.
Once the checks have been completed, the patient may now be transferred and endorsed to the post-anesthesia care unit. Important details upon endorsement include the procedure done, type of anesthesia used, presence of drains, and any special concerns.
PRR 90 equal to 90%. Estimated blood loss 46. Best given oral lap 30 mg IV. Tramadol 2 mg IV 11 p.m.
Most of workers, monitor vital signs closely. To oxygen 45 liters per minute via face mask. May elevate moderately high back rest. NPO temporarily at PACO and then DAT. Diet is tolerated at ward level. Then LRS 1 liter per 10 hours. The follow pre-NSS 1 liter KVO. Meds ranitidine 50 milligrams IV every 8 hours, while NPO ketorolac 30 milligrams IV every 6 hours for 4 doses. Skin tests are negative, given ketorolac at 11 a.m. Then tramadol 50 milligrams through IV.
The patient safety checklist is a simple system designed to help the surgical team execute their duties while ensuring the safety of their patients inside the operating room.